It would be great. Thank you all so much. We're going to go ahead and get this meeting to order. So we are here. Hello, hello, hello. I do need a gavel. We're here for the Mayor's Task Force on Homelessness. Thank you all so much for being here. Thank you so much that we were able to skip the last meeting, but I think there's some really productive work. So that happened in the month that we took a bit of a break. So I'm excited to hear everything that comes and is reported out. So first things first, if we can, and again, my name is Diane Fleet. If we can look at the March 11th minutes, and if I can have any corrections or additions as you look at those minutes? Thank you. Second, wonderful. All those in favor? Any opposed? Then we shall accept the minutes as included in the packet. Thank you so much. I also wanted to announce, you all may have noticed that Abdul Muhammad is no longer sitting next to me. He did have a job change. I believe he and his family have moved to Tennessee. I know. So I hope we can wish him the best of luck and send him good wishes, even though I have dark thoughts about him, that he has abandoned me. But anyways, if you're wondering where Mr. Muhammad is, that's where he is. He is now in Tennessee. I also want to take a few minutes of our opening remarks. Many of you, all of you were invited to go to the tour for the Volunteers of America Community Care Campus. I'm so happy that many of you all were able to attend. It was eye-opening regarding all the different services that they were offering, the uniqueness of the different populations, the location of it, the size of the location in the campus. But I just wanted to spend a quick few minutes if anybody who attended had any comments or statements or anything that kind of came to your mind as we were doing our work, if you had any epiphanies in your visit. So I will open that to anyone who went. Mr. Morton, did you have anything? I don't know why I'm looking at you.
I mean, I think it was one is a great opportunity. I think they have a lot of many different pieces and serving many different populations. I thought it's a great asset for Louisville, and I look forward to seeing what we can bring here to Lexington. So I think it was a great opportunity to go up there, and I think I look forward to going back and seeing it once it's all built out. But they've got it's looking good so far.
Yeah. Thank you. Thank you for letting me put you on the spot. It's always easier when someone talks first. So thank you so much. Anyone else?
I always have something to say.
Yeah. Thank you, David.
You know, I was really impressed by the amount of different groups that they're serving. One of the things that I particularly was interested in and still want to find more about, they had sort of an outdoor designated like safe space where they had some old donated CVS, I don't even know what to call them, containers that they turned into sort of like mini homes. And I think it was a really cool idea. And they were painted, and they weren't really eyesores like you would think they would be. It was a really nice addition to the campus, I think. And I was particularly intrigued by that because I think that is an area that a potential gap that we see. Especially when we're talking about kind of the low barrier ideas, having a space for that population, that group. I think that was a neat idea, and I think a good use of their space. Overall, I love some of the ideas that they have, and I again, like Councilmember Morton, would love to go back once it's complete and kind of see what the final picture looks like. But I'm impressed by the ideas.
Anyone else?
I didn't go, but I had Carrie and Kelly go.
Yes. Yeah.
Okay, so I can give a report of their report. And I will say that they were, you know, the segments of the population that will be served were maybe not what we have to serve, but maybe some, you know, some overlap. But they were impressed that they have those bed bug chambers. I don't know if you all, that really, we're getting one. We have to have it.
It's like a hot room.
It's a hot
It's like a
room.
hot room.
And it is what works. And see, I looked at them several years ago, but I'm going to suggest that if you all don't have one.
We have a small. We have a smaller. It sort of is a tent.
Yeah.
Like a small tent that you can put belongings into. It is very effective. They're large and really need a whole room.
Yeah, well, there are some now that are coming that are really reasonable. You know, it's the bane of existence. Even, you know, doesn't matter what. But anyway, they were impressed with that. They didn't want us to miss that. Mm-hmm. But no, they felt it was a good turnout with people, and when it's finished, it'll really show what it's about. Well, there are three main populations, as I understand. They're going to have a respite. They don't have it yet. They've got the families, and then they've got the youth, the 18 to 24. And I believe they said it to everybody, and I'm sure you all know it. The reason that those are the ones that you can fund. So there were some of those who they're not serving that are not those who can fund. You know, it's just harder to do. So I think it's an example for us that we do what we can. You know, as much as I'd like for us to be able to do everything, and all of us would, I think that is a good model of what do you have, with the needs, what can we do rather than we can't do anything because it's too big.
I did very much like the community partnerships, which fits a little bit in that.
Mhm.
So in the respite piece, there was a lot of work with the local hospitals. There was some shared services and shared funding and how to maintain that. And that was sort of dear to me. There's nothing seems worse to me than to be on, you know, in some sort of hospice care and to be homeless. So I I sort of love that. But yeah, I think you're right. Yeah.
The only other question I have that maybe you all got answered and they weren't sure, and I think they were, is that they were talking about that it's 90% government, 10% community funded. Is that,
That's what I recall. Mhm.
that's what, yeah.
I think that was their overall package of programming is that split. I don't know if that is specifically for the campus.
Oh, it wasn't the capital part. No, yeah, I should have qualified. Operational costs are 90-10.
I was under the impression that, and Ann might be able to
I know,
speak
that's
to
what we were
this.
thinking. You should have
I
been
think
there.
that it's more in general, Volunteers of America as an organization, all of its services, not specific to just the operations of the campus. Am I correct?
Yeah. And federal, state, local. Yeah. Yes. Thank you.
Almost that hard.
Councilmember Sheehan, did you have something, Liz?
Yeah, a couple things. Well, first, some of the federal funding is being reduced, so we might have to pay more locally, but that is a bigger conversation. About the actual location, I did, even though everything is not fully built out, I did appreciate that they were thinking about accessible design. So, like one example that keeps popping into my mind is having these foldable seats in the shower spaces. For folks. So I really appreciate that they were kind of forward thinking on that, even though it was hard to kind of imagine the space because of all of the construction and like how someone might navigate it like in a wheelchair or with a mobility challenge. But there were touches there that I was like, okay, they're thinking about this. So that was one piece. And then the other piece that I want to highlight was right before the tour, we had a group discussion and there was some conversation with the city government there about what they are doing to be transparent about their funding and how the funding is being spent and who they're serving through like a dashboard. And we have our Lex End Homelessness website where maybe some of the information that they're talking about when we're talking about the solutions here and how we might progress, some of the things that they're doing there, we might want to consider incorporating for public transparency.
That's a good point. Thank you. All right. Well, I think it was really helpful. We've had a lot of folks come in and meet with us via Zoom, especially the peer cities peer model group. But it was really nice, even though it wasn't done, you could begin to imagine, what this was looking like and pick kind of the brains of the Volunteers of America folks who really have an amazingly thought out plan. So yeah, it was well worth the afternoon, I think. So we're going to move into subcommittee reports, and just to be thoughtful, each group has about 5 minutes to report. I'm sorry, but just trying to be thoughtful of time. And our first group is supportive service and prevention services. And David, I think you're up first.
In for TC. Oh, sorry. I'm filling in for TC, so I will be as brief as she is. I don't think I can do it. Really what we did in our last supportive services committee is we sort of took a minute to collect some of the ideas that we had been talking about, try to begin fleshing out some of these ideas in preparation for actually making some more concrete recommendations. So we just sort of nailed down some of the overarching points that we've discussed throughout the committee. Starting with reviewing the recommendations from the homeless study, looking at the number of beds that were needed and this idea that we need roughly 500 beds. Talked about the use of the potential use of the Versailles Road campus to cover some of that need, including like family housing, or family shelter for people with disabilities, some of those high need groups, elderly. We know that isn't going to capture the entirety of the population needs, but I think that is very similar to what VOA was doing in Louisville with sort of that core group of populations that they were serving. So I think that sort of was our concept when thinking about what to do with the Versailles Road campus. The idea that we will continue to need a low barrier option elsewhere outside of that campus, and we'll continue looking at that and trying to come up with ideas for that. We also talked a lot about enhancing the current existing shelter system, improving case management in the shelter system, reducing the case management load, making sure that staff are adequately trained and are prepared for the populations they're dealing with, making improvements to the shelter that will enhance the ability to deal with things like mental health crisis and people that may get restricted from shelter in the environment that we're currently dealing with. Essentially, by moving some of these other subpopulations into a separate location, reducing the strain on some of the existing shelters would allow more individual interaction, and we'd work towards reducing some of those issues. We also discussed the idea of developing a work group to further study the pet accommodations, how we will go about addressing that issue. That's been an ongoing issue throughout the winter shelter. So bringing in some sort of experts in that area to further flesh out a plan for that going forward. We talked a lot about diversity or diversion, and talked about eviction prevention strategies, working with groups to never be homeless in the first place. And I think that has to be an important part of what we're doing. So talked about different strategies for that. We again talked about the idea of having a centralized triage center, an area where first responders or people just walking up could go. They could get an assessment and be directed into the existing shelters or be directed into the appropriate resource. That way we're not sending people all over the place for, for different resources that may or may not be appropriate for them. So this sort of central idea, improving the flow, just being more efficient, and also providing a place for community partners to interact with each other. And also engaging volunteers. We have a lot of people who want to help in the community, finding ways to engage them in working with this population, dealing with some of the, honestly providing some of the workforce there. Let me see, just read through. Yeah, and so I think that was essentially it. Going forward, just working on, like I said, finalizing some of these recommendations, trying to develop some strategies going forward for short-term goals versus long-term goals. And I think that's where we are.
Thank you. I appreciate that. Is there any questions for David? Good. All right. Zach, I have you next, Mr. Worsham, but I also have you a little bit at the end. So I just want to make sure you've got 2 spots regarding recommendations for funding and partnership. So you choose what to share now and later.
Sure. I'll just say we continued to meet a few times in the interim, and luckily the last time we met, we had the benefit of the recommendations I think we'll hear about later from the joint recommendations from 2 different subcommittees, which start to kind of formalize a vision for something that's more like a project and some policies and programs that we can start to tie dollars to. So we'll get into that at the appropriate time later. We've got some recommendations, kind of draft recommendations pulled together, and we've continued to have discussions with Charlie and with Rick McQuady to talk about ways that the Affordable Housing Trust Fund can be better utilized to support permanent supportive housing projects. I don't think we're today going to have any recommendations to bring on that. I had a conversation with Mr. McQuady this morning, and he's working on some draft language that we can bring to this group for consideration to maybe some changes to his policies. But I think that's probably enough for now. So,
Thank you. Does anybody have any questions for Zach, or do you want to kind of move on to the next subcommittee? Good. All right. So next we are peer cities and shelter models with council members Morton and Beasley.
Thank you. So we met and we started discussing some of the things we want to see on this campus. We were asked to come up with a wish list and rate them in alphabetical order of how we wanted them to be done. So we got with another task force another subcommittee, and started discussing those. So some of the things we talked about was a campus model, making sure that we had a 24-hour, 7-day a week. We called it a intake center, but I guess it's the same as what the other committee's talking about with their triage. We also talked about at least while we are deciding where or are in the process of building a permanent shelter, to keep the temporary shelter at the Versailles Road location, just because we've already done the work and it's easier to build upon what was already there than to try and find another location. We talked about who we thought we could house on the campus, and it was just about the same as the Volunteers of America, with the respite part, the families, and some of our elderly folks. And we are not going to meet again in June. We are just going to email back and forth to try and finalize some of the recommendations we have to bring forward to the task force. Thank you.
Thank you. Yeah. Jenny?
At least you didn't say 86. What about the general population?
So when we were discussing it in the subcommittee, if we move some of,
Amy, I'm going to have you talk on the mic if you can.
sorry, when we were talking about sharing, when we were talking about it in the joint meeting, if we are moving some of these other folks out of that single population housing into the campus model, that it'll free up more beds.
It might free up more beds, but we need more beds than that. I think we have got to look at general population, or she's saying the families, the elderly, disabled, and the respite. And I love the fact that they're being taken care of. But we're talking about general population, people who don't fit in there, the regular folks, the men and women. Yeah, and maybe the youth, depending on what happens with youth. But I mean, we did say we'd leave, we know we need to leave the people on the registry off, because that's not a place where they could be. But the general population is.
Janice, I'm going to have you in the microphone too. Sorry. Yeah.
I think, and we had discussed that by serving those groups, that like the people who serve the single men, I think David had kind of thought maybe they would be okay in serving the single men. Now, Salvation Army is a different story. I don't know about the numbers on that, but that was what we had thought at the time. So you're really talking about the single women more so, probably.
No, I'm talking about
Single women and
single women
and
and single people who don't fit in those other categories. We've got a lot of them. They're the single men, they're the single women, they're the 45-year-old couple. They're the people who are addicted. It's just a large percentage of the population. In fact, Jeff, do you have those percentages?
Yeah, so I would have to reference that from somewhere, but just to kind of give some context to some of the conversation that happened in that joint committee session. For example, looking at Hope Center's annual data, they are serving 25% annually of their persons are 55 and older. And we saw a similar trend at the winter shelter. And I know that David's expressed on the tour that we took that whenever they get free space available, they're constantly trying to squeeze more beds in. And so part of the conversation that took place in that committee, and obviously people are free to raise a different opinion or evaluation, but part of that conversation was by alleviating a little bit of the pressure and really focusing on, as space would be opened up at a shelter like Hope Center, being able to really better address service needs there and correcting some of the kind of staffing ratios. I think the other kind of recommendation that will come up that plays into this is really increasing the case management that is available within the community and potentially making that a external source from some of the shelters themselves, so that that's not a barrier to engagement. If someone's frustrated with the shelter, they don't forego case management because it's a shelter staff member, and potentially creating greater consistency in how housing navigation type services are done to more rapidly move people out of shelter. And I think, again, kind of similar to with Louisville, I think we're trying to think about if we were to, for example, use a space like Versailles Road for this, how do we make that something that the neighborhood impact is manageable, and that we don't force every population to be served on the same particular parcel or property.
Yeah, I was going to add to that. That's one of the things that we discussed is, you know, the Versailles Road campus is not going to address the entire issue. Like we have, and I think the short-term goal in the next couple of years, overall, we think we need about 500 beds, right? But over the next couple of years, we're looking at establishing somewhere in the neighborhood of 200 to 300 of those, but there still is a more long-range plan to add in other beds to get us to the capacity that we actually need. I don't think we can do it all at once, and the Versailles Road option will not really allow us to do all of it on campus, and I don't think it's appropriate. You know, you don't necessarily need to house everybody in the same place, as Jeff said, but you know, we can start there with, you know, the families and some of those high need populations, then begin to focus on some of the others. But I agree, you know, we still need to address the ongoing issues, the low barrier needs, and some of those other things. So I think sort of in stages, initially we can work with getting a campus off the ground with the spot that we already have, and then develop from there. So that was part of our discussion, is there would be more of like a short-term versus long-term goal.
I think we also should just be mindful too about how we define families, and not necessarily excluding couples if they don't have children from that, and recognizing that we have like some blended families where it's maybe, you know, adult children that are in the household and things like that just haven't neatly fit into our shelter system being so segregated by things like gender. We have some flexibility with some of our shelters sometimes in being able to accommodate a family that doesn't have minor children, somewhere like Salvation Army, but it's kind of more the exception than routine. So that's another thing that I think, just to be clear with you about when we're talking about maybe prioritizing some of these populations, I think there's still a pathway that, you know, couples can be a part of that as well. And that's not somebody that's going to be completely left outside of who would be prioritized there.
And then just last, I think everybody, all the conversation is great and correct. I think we also, how we got to those populations was we looked at the gaps currently. And that's exactly how that kind of those recommendations came forward. Just looking at the gaps for families, looking at the gaps for our elderly communities, but then also we got into a conversation about even unhoused folks with their pets. And we spent a little time with that because we're trying to figure out pathways for that. So I think it was really more so looking at those gaps, and we went from those gaps to move forward. So that's what I'll put in.
And not to shorten this conversation, but I think this will open back up when we look at our recommendations as well. And we'll kind of go through a little more about how we came to that. But Mary, I think you had a comment.
Thank you. I have a comment and then a question. To your statistics, Jeff, 25% of Lexington's population is 55 or older. So it absolutely mirrors what the Hope Center is doing. And so I think that's not a surprise at all. And it would be more surprising if those statistics were different.
We also, in our 26 Lex count, the subpopulation that had the highest rate of growth was seniors 65 plus.
Yes.
They made up 10% of the individuals that we have included in the count this year.
Yes. And then I had a question, but maybe it's farther in your report. I haven't really heard anyone talk about, and I haven't been able to make all the meetings, so about you know, the goal is to get people out of homelessness, and what the successes are of the places you've looked at. You know, I think about the jail right now, who they are doing fabulous work with people with mental health, people with addiction, people who were homeless, who are getting ready to be released, and they're going out on a different path to housing, to jobs. So I haven't really heard anything about this yet, and I'm anxious to hear, is that what some of the successes are in the model? these
So I don't know that
shelters?
anybody's like we've actually come up with a recommendation for that, Mayor, but in at least our meetings, it's always been how we can help the ones who can eventually live on their own without any assistance from us, be able to do that while still assisting the ones who may never be able to do that.
But in your shelter models, has anyone talked about that?
The only people who have talked to us about that is the ones in Nashville and the programs that they're doing with like their job training on site
Okay.
and their financial classes and that kind of stuff. Like
Mhm.
the Nashville shelter, they have to actually like put in the work. They have there's classes that they have to take or things that they need to do in order to move forward in the program.
And they're having success.
They are, yes, ma'am.
Yes, thank you.
Yes,
Thank you.
And I'll hop in as well. So I think Councilman Beasley is 100% correct. And what I think we realize is I think they're all kind of different in nature. So like one of them, the one in Austin, was more so that's kind of living on the property. So that was that's their house essentially. So that is success in their definition. The one in Nashville kind of gave success rates, but I think they're all were kind of different in nature in how they define success. But I would say every conversation, that we've had has always emphasized those wraparound services, making sure that we're having whatever location we do have, that you can have all the resources that you need to be able to get to a sustainable level and hopefully get out of homelessness, whether that be the resources, whether it be access to transitional housing after you get to this more solid platform. It's always been the goal to get folks to actually address the challenge with full holistic solutions, I would say. So.
Thank you so much. I'm going to go ahead and shift us, if it's all right, to go ahead and talk with Ginny Ramsey and Councilmember Ellinger about community engagement.
Thank you. Since we met here as a task force, the subcommittees met 3 times. The first time last time we met was the first time was March 25th at a 3:00 Zoom, and we did it with our neighborhood listening session. You can see on the top, we always put what our mission statement is, and we've just tried to have these listening sessions to engage different areas in the community. And this one was the neighborhood one. We had 4 questions that we asked, and we had 10 neighborhood representatives that showed up. Some of the things when we talked about additional shelters and services are needed for those experiencing homelessness, Mayor, gets to what you had talked about. Shelter should not be the end stop. We need to look at permanent housing, wraparound services. When it came to concerns about need of expansion, we needed resource for sustainability, job training, healthcare, holistic approach. What can we do to make their lives easier? If a homeless shelter were to open a neighborhood, what measures or guidelines would you want in place to ensure safe and comfortable in your presence? We need to make people part of the community, need security for after hours, cleanliness, density of homeless people in the north end needs to be a way to space it out and provide services. And the last question, any ideas on solution? We have activity centers for homeless people, public transport, need more support for families and children. Elderly should not be in the same shelter. Convert abandoned buildings to affordable housing. So those were some of, you can read through and hear some of the comments in there. So that was the first one. Then we had a meeting that we had for the subcommittee on March 6th, and we just kind of went through what we'd had in that one. Then we set our next meetings, and then our next meeting was public safety that we had on May 6th, and Ginny's going to talk about that. And then we also set our last meeting, which is going to be a general public one on the 21st. It's going to be at night, and it's going to be a webinar that we're going to be for the whole general public. So we want to make sure we get this out as social media any way we can, so we can get as big of. We're going to do a Zoom, but I've been told that Tiffany wants us to, because our expectations will have a big turnout here, so we'll have somebody that can kind of control the webinar a little better. So we're going to have that on the 21st at 7 o'clock. And then Jenny's going to talk about our public safety that Jay Blanton, he was the one that was in charge along with Jenny.
It was a good meeting. There, we had the Eastern State represented, talked a lot about empath. We had the, trying to think who was sitting up there. But, oh yeah, the police and the firefighters, which would include the paramedicine. We had one hospital. And I just don't have my notes right in front of me, but I want to say, I do know what the overall was. It was excellent in the fact that they are down on the streets. Oh, thank you. Okay, Eastern State, UK. And I mean, the folks from here. But the biggest thing was the police seemed frustrated, I must say. They were very frustrated with the population and seemed to have some ideas about previous years of the, as well as this year, of the winter shelter being very detrimental to the area. Of course, we get a little sensitive about that one. But the truth is that the area they were talking about from last year, when it was a motel model, that's been an area with campers forever. I mean, we deal with those camps out there for the past 10 years. So sometimes the folks, even our own public safety folks, get the wrong impression. I think that that's a real important piece, that they felt like it was possibly more of a challenge for, you know, not that they won't be challenged, because wherever it goes, they have to be partners. Every one of the people who came to this will be the partners with wherever a shelter is, you know. So it was a good meeting. They were very open. I mean, that was the nice thing, is they did not hold back, and they felt like that we just have to keep on, and, you know, we're all in this together. So basically, we were hearing from our professionals and those who have worked with this population for a long time, and it was quite interesting that way.
It's probably important to point out those comments only came from police. The comments from community paramedicine were very supportive.
Very supportive. Yeah. What else did you hit you, Charlie? That was bad. Didn't you feel a lot of support from all the others? And that they want to see not only the shelter successful, but the understanding of the complications of dealing with this population. So,
And I just want to reemphasize that May 21st at 7 o'clock is when we'll have our webinar. So please get the word out. Well, I think we can take 150.
well,
Okay.
we were planning on 150 on the Zoom.
We'd like 1,000.
The whole world will show up,
That's right.
Tiffany. If they think they're going to have their, but we're just listening. See, we got to remember, this is our listening session. We're not there yet. Yeah.
And we're just trying to take comments. So yes,
Yeah.
let's get that word out. Thank you.
One question, Jeannie. Did the police have any suggestions, or they just were telling us what was a problem?
They kind of, do you have any thoughts?
I do, sure. I'm happy to speak. I'm Daniel Burnett. I'm the West Sector Commander. What's that?
that's not
There we go. Look, the police position is just, and this is a statistical fact, this is not an opinion. We see a dramatic spike in calls for service across all public safety domains, wherever the shelter is. That's it. And the surrounding community always expects, demands, and deserves a response. Unfortunately, a lot of times those response involves the surrounding area, not directly the shelter itself, which is where largely only police and fire have any ability to do anything. So that's the police position.
Well, and we appreciate that and do understand that the shelter staff can't police the whole area. I mean, that's another thing that often folks in neighborhoods don't understand. We don't, we can, like at the center, we do the best we can to encourage our people not to go places, but we don't have the enforcement yet. But, it's just tough. I mean, I'm not going to play like it didn't. So,
Judge?
Commander, is it more loitering type of calls, or are there public offenses being committed?
no, they're actually.
I was asking the commander,
Oh,
Jenny.
I'm sorry.
All the above. All the above.
Yeah.
It, of course, includes things like trespassing, public intoxication, et cetera, but we also see assaults, disorders, thefts. It's the full range. And we've provided some of that data, can always provide more of that data.
One more question, Commander. Is it more than the permanent shelters that we have?
Yes.
I think so we'll go ahead and move into recommendations, but I think it's an interesting piece because I sat in on the joint committee pieces. And I think when we were looking at where in the city something was going to be placed, what's the surrounding, what are the neighborhoods, what are the businesses? I think when we leaned a little bit as to what populations, we thought some populations might have more impact than others, because we definitely wanted to be more thoughtful to the surrounding community, knowing, as you said, staff can't police the area. So would maybe seniors be a less impact on crime in the community or family? So anyways, I appreciate you sharing all of that. So we will move to recommendations. This was a committee between supportive services and prevention services and peer cities and shelter models. It was in your packet. Commissioner Lanter has agreed to kind of walk us through section by section. I want to make sure we do have enough time for Zach to talk, and then we also have to make sure we have room for public comment. So you might not have the full 10 minutes per section that you thought you did. I'm so sorry.
Does this work? Oh, it does work. The light doesn't work, so I didn't know it was on. Okay. I'm just reading these. These are not Charlie's recommendations. This was, y'all have heard the group talk about the joint meeting. These came from that joint meeting. We are just the readers of this so that y'all can discuss it. But what I want to do is walk you through some draft, and I stress the word draft recommendations. We just need a starting point for discussion. So we're giving you that. What I'm going to do is read, these are grouped by a few headings. They're grouped by emergency shelter / transitional housing, permanent housing, diversion, and supportive services. So if you would just consider, like, sometimes your question might be answered in one of the later ones because services is in a different recommendation group than shelter and transitional housing. But what Diane and I discussed was I'll basically present for you one of each of these groups, and then we will have was going to be 10 minutes as a 5 to 8 minute conversation or discussion about them so that we can get your initial feedback and thoughts, and then take that back to the committees so that the committees can adjust these, change them as needed, reword them, and have further conversations. So that's all this is. This is not, we're not anywhere near writing this down, taking it to the mayor and saying this is our report. I just want to make sure everybody understands that. The first set of recommendations are on emergency shelter and transitional housing. And they go with the discussion you've already heard about the Versailles Road campus. However, I want to say this. There was significant discussion in that room about minimizing impact, about how do we, if we're going to do something there, how do we minimize the impact on the neighbors? And the nature of that discussion was around population that's going to be housed there. So that, I think, gets to some of Jenny's question about why it's this population and not that population. Currently, the population there with the seasonal shelter is general population, for lack of a more specific definition. It's general population. What the committee is saying is this is probably one of the few sites you have in Lexington that you can use. So use it, but do something there that is lower impact. So serve a population like families, seniors, people with disabilities, groups that are not going to leave the campus They're not going to, there's not any reason to walk past the site they're at, and that don't have the myriad of challenges that sometimes come with the general population. And I think you will find that is a significant difference if you've ever lived next to like a senior apartment complex versus being near a shelter. They talked about doing a site study, and that's really just the logistics to see what you could get on that property. Interesting thing they learned in Louisville was that the acreage that Louisville is using is essentially identical to the acreage that is at Versailles Road. I was really surprised by that because when you walk the two, they don't feel the same size, but they are. Theirs feels bigger, probably just because it's in a very urban setting. But prioritize the resource development for underserved populations such as elderly and disabled. That was just getting at what I've already said, which is serving the lower impact populations. And then there, you can see with D, we're trying to address that public safety challenge of coordinating with public safety to ensure adequate levels of support and collective response. We've got to work together. This cannot work if it is this group operating it, this group policing it, this group complaining about it, this group living next to it. Everybody's got to be on the same page or this doesn't work.
I'm sorry to interrupt. Can you define adequate levels of support when you talk about public safety? What does that mean?
I'm just reading, so y'all.
Who knows the answer?
I'll give an answer. I might not. I mean, I think just in conversations we were talking about, I know that safety is a big topic that comes up when it comes to surrounding communities, just in general, and then even the safety, on the campus. So we wanted to make sure that there's adequate public safety, whether it be police, whether it be fire, whether it be paramedicine, adequate public safety holistically while we're looking at other locations. So that concern, which is tend to be one of the main concerns when you're talking about locations of public safety, is kind of front of mind, I guess you would say.
Okay, so you didn't have anything specific.
Well, we discussed some things that are
This number of
specific.
police have to be there all the time. This number of.
We
paramedics-
started to have that
Okay.
conversation, Mayor, and one of the things that was suggested, for example, is police presence at whatever facility you do. Do you set something up there where there's a regular presence or a shared presence or some kind of shared space? We got pushback from police on that they would not be willing to participate in that. So that was not included as a recommendation. But there's still a lot of other creative things you could do to work together.
And won't it vary depending on who we serve there? Again, going into.
Oh,
that.
I'm sure.
Yeah,
Absolutely.
So that's not concrete yet, so.
Sure. And then lastly, just because Louisville's is a great, I guess, reference and the reference for the day. At their site, they actually are going to have, police on site. I don't know if they say 24/7, but that's almost they pretty much going to have an office, pretty much. And that's exactly the lens that we're looking towards. If this is a city partnership, as Commissioner emphasized partnership, that means all of city coming forward, even if there's kind of pushback. So thank you.
Any more discussion on that before I move on? Okay. I need to scream and tell somebody I need to scroll, but it's me that needs to scroll. Oh, no, somebody does need to scroll, whoever's running this. Provide support to existing shelter providers to expand and improve currently available resources. This was the discussion that Jeff had and you all had already about making sure that once you do this in step one, you also go to the existing shelters and see what opportunities exist to expand their beds or to take on new populations as you've adjusted that work. That one's pretty non-specific. I would suggest maybe some discussion to flesh that out a little, but that's just my own personal recommendation. Recommend development a resource assisting persons with pets in accessing shelter. Just to give you a little bit of discussion, context for that discussion, we didn't feel like you could justify a shelter for pets. A shelter where if you have pets, you go to this shelter because it's not enough people to warrant a shelter, and it's a complicated issue. Like because you're going to have every type of population is going to have a pet, and you can't have every type of population in the same shelter. So that's not the way you attack that. The idea was to attack this either by providing shelters with resources or grants, or working with them to set up the ability to take animals at the existing site, and or working with the LHS or some other I was going to say adopted partner, but the ones that do foster is the word I was looking for. Fostering different types of creative programs where you could have someone care for the animal while they're recovering or whatever it is they're doing. Because sometimes the animal's a barrier to recovery too, a barrier to entering recovery and things like that. So that's something they're going to have to look at. And then finally, in that first group, support the development of additional medical respite beds to support chronic or long-term needs. That's just an acknowledgement that our current medical respite program is not adequate. It doesn't meet the need. So that is the four that are specific to emergency shelter or transitional. Everything from there goes to permanent and services. So before I move to permanent, questions and discussion on those.
I don't think so. I just want to reiterate a little bit what David said regarding if we can kind of, we dabbled a lot with age, right? We were like, what's a senior? Is it 55? Is it 60? Is it 62? Is it 65? We kind of went back a little bit in our conversation, maybe looking at 55, because we thought that might kind of relieve a little bit of Salvation Army and the Men's Hope Center even more. And then we talked a lot about kind of best practices of how many, like what a good case management ratio was, because we were worried about general population, Jenny, as you would say, people being kicked out because of rule infraction, but we thought we could mitigate that a little bit better if you had a caseload of 1 to 25 versus 1 to 80. So I just kind of want to say, I think that was sort of a critical piece as we were talking about who we thought the shelter was for, what the age is, and why we thought that fit, because we thought it took some of the burden, for lack of a better word, off of existing shelter programs. Commissioner?
Yes, the only thing that I would wish to share in regards to recommendation number 1 is to account for the fact that, and this is if it goes long term, is that is the Versailles Road campus is an active site for municipal services and programs. So we would have to, if this recommendation were to move forward, it would be wise to account for mitigation. How do we relocate and account for displacement of those services that are out there? I think it worked well. We have 3 units out there. There's building 1, 41,000 square feet. Building 2, I don't know what that is offhand. We utilize the 3rd site, which is the hangar, for lack of a better term, that served our emergency shelter. So if the entire site were to move forward as a recommendation, we need to note that it's not a vacant site. It's an occupied and active site that would have to be accounted for as part of the planning, that mitigation.
Besides the shelter, what else is on that site currently?
Just very, very quickly, in building 1 is Global X, Bluegrass Health Clinic, formerly the Metro Employees Credit Union. And last but not least, on the backside is the county clerk's record storage. That accounts for the 41,000 square feet in that building. And so that's just a note, just to account for the committee to be aware of that.
You wouldn't want to move the Bluegrass Community Health. That'd be a real asset, so.
It could be part of the plan.
Yeah. Mm-hmm.
They were not active participants in the shelter. It wasn't as symbiotic as you would think.
Yeah, that would be a good thing to, Councilmember Sheehan.
Thank you. I do agree, Commissioner Lancher, that we need to have some more definition on point number 2, because I feel like we're here today because our current resources are exhausted. So expanding the current shelters, I love the idea of more case management to help people get into more stable situations and out of the existing shelters. But the idea of expansion, I think, is going to be a really hard one, because that will take a lot of resources, and I'm not sure that our current shelter spaces have the ability to expand at all where they are. So
and I should mention there's an item under services that attempts to address that.
Yeah. Okay. Thank you.
I would with Commissioner Ford, I agree with Commissioner Ford. I think, and if shall this move forward, maybe there should be a E that looks at the feasibility of moving all those services or programs to other locations. So that'd just be my thought. so that it could be addressed.
I'm going to go ahead and move to diversion, but I know that people have more thoughts on this. So you are absolutely welcome to share those after or on email or whatever. And we will continue to have more of these conversations in the committees as well. Under diversion, we really wanted to emphasize diversion because every person you can divert from shelter is basically a bed. You know, if you keep someone from going into shelter, that's a bed you didn't need. That's a bed, and it's a whole lot cheaper way of getting a bed than building a bed. So diversion, and which is something our system is not particularly good at right now. Provide system-wide training and support to increase diversion efforts, particularly among shelters and system access points. This is about getting the shelters refocused on housing focus, and the first question not being how'd you get here and how long are you going to stay, but the first question being, do you really need to be here? Is there another solution for you? Completely reprogramming the first question. And it's more complicated than that. I'm oversimplifying for time, but that's what that means. Item 9, work to increase the level of prevention funding available. That's just because there's currently little to no prevention funding, which is one of the reasons we don't do a lot of prevention and diversion. The Emergency Financial Assistance Program and CRS is one of those. Continuing to expand and use the OHPI Flex Fund. That's a new fund that has only just started in the last year, 6 months even maybe, that's funded out of the OPI fund. The Emergency Financial Assistance is funded out of the general fund. I caution on rent assistance. Sally's heard me give this speech 1,000 times. We spent $53 million on rental assistance through the pandemic and did very little to move the needle. Very little. Rent assistance is not the answer. Rent assistance is just a tool to get you somewhere or to buy you time. So always keep that in mind when you have those conversations. Increase the level of case management resources available to be paired. This is getting into services. One of the things that emerged in the committee discussions regularly was the lack of case management or the lack of people who can do it, therefore leading to large caseloads. So in a industry, case management for the homeless, where the caseload should be 1 to 20, 1 to 25 if you're pushing it, it's really closer to 1 to 80 in our system. Is that fair, David? I think that's the number we had used, 1 to 80. You're not getting someone out of shelter if you're only seeing them once every month. And if you have 80 people you're responsible for, you may only see them once a month. So that's how people are getting stuck and languishing in the shelter. Again, if you can get them to move out, that's a bed. You've just created a bed by moving someone out of shelter. Increase the level of case management resources paired with financial assistance programs. Oh, wait, I already read that one, sorry. That's all of the diversion ones. So if y'all have any discussion on diversion, that's the whole thing. Questions? That one's pretty short. Good, we don't have a lot of time. Supportive services. Develop a centralized triage and intake center to support resource navigation, create opportunities for organizations, advocates, and stakeholders to support local strategies, such as on-site office space for those agencies. This is something we're really excited about. This is something that the providers in the community have been asking for a long time, and that is a central location, a centralized point where if someone's homeless, you can say, go here. They'll take care of it. Because, and y'all remember, we had this conversation at one of the meetings. Reverend McFarland had brought up the issue of if I have a friend who's homeless, I don't know what to tell him. And our answer to him was, our answer is always, it depends. Are you male? Are you female? Do you have kids? Do you have a family? Do you have an addiction? Do you have mental illness? There's so many ifs. What this is saying is we need a place people can go regardless of if to be triaged and assessed and then get them to the right place. And that right place is probably not that site. That's just an intake site. That right place, it may be the Hope Center. It may be the Salvation Army. It may be something new that we haven't built yet. But you're doing an intake and triage, and that's where your diversion can take place. If you go back up to the diversion recommendations, if you've got them there and you're not sitting there in a shelter saying, here, have this bed, it's a lot easier to have that conversation around, is this really the best option or the only option? Because maybe there's something better for you. Also on supportive services, we want to support the development of a community-based case management program. The important takeaway on this is it would not be hooked to a shelter or a program. This would be new and different. And this may take some explanation from Jeff or maybe some others, but we would call it third-party case management. The problem right now with case management is You can only get that help for however long you're in that shelter or in that program, because the person who's helping you, their salary is paid out of the grant that runs that shelter or the grant that runs that program or whatever. So they can't help you once you've moved on. And in theory, you move to the case manager at the next program, but in reality, that doesn't happen. So what if you pulled all that out and did the case management outside of that network, so that when I move from the Hope Center to transitional housing to something permanent, I can keep working with the same person. I don't lose them because they're a Hope Center employee. That's what that's saying. Jeff, do you think I explained that correctly?
Yeah, I think another element of it too, and I know this came up in the board meeting prior to this, and sometimes there is lack of engagement from a case worker in shelter because the individual is frustrated with their situation, and so sometimes they project that onto the Hope Center or the Salvation Army, and it's hard to really build a relationship that builds us an appropriate level of rapport to really identify goals and action steps and do meaningful work. And a lot of it is to the kind of challenges that we have with case management positions being so tied to specific programs that there's not an ability to really follow someone and carry them through the entire continuity. In reality, no matter how many caseworkers that we put in shelters, they're going to get pulled in so many different directions in managing daily operations that it lowers the level of case management quality that's actually being provided. So this would be something that we would think of as helping casework staff do more light touch, basic needs case management. We're going to get you an ID. We're going to take the simple steps. And then for those that are willing to engage a higher level of service, work on higher level goals, they were going to get more from this kind of a case manager. It also would create one case management team that's doing more consistent services operated so that you don't have differential outcomes in one case manager at one shelter versus another.
Thanks, Jeff. And then the 1959 funding, could you take that one? I haven't been in those meetings.
Yep. So the 1915 I-RISE initiative is a new rollout statewide that allows for those that would have a serious mental illness to receive housing navigation services through a homeless service provider that is licensed. And then they are able to then get reimbursed by Medicaid for certain services. Right now, we just have a very few sources that can provide ongoing case management. And oftentimes it's tied to those that have certain populations, like those that have a mental health condition that are qualified for insurance for targeted case management. That has to be recertified on a quarterly basis. There's only certain services that it can provide. So this would be the notion that we have somebody that's able to do more intensive work with an individual, and it's giving an ongoing sustainable source that our providers can try to recoup some of those funds from.
And the next group is funding and finance recommendations. So I'm going to turn it over to Zach because he's handling those.
Funny how that works when you hit push to speak, isn't it? Just one comment, Madam Chairman, before Zach takes the floor. This is not a criticism, but just a comment. I'm springboarding a little bit off of the mayor's comment a little bit earlier about expectations. It's disappointing, and I hope we can address it at some stage, but throughout these recommendations, there's no mention of accountability. We're not asking anyone who we're caring for, and I'm excluding the mental health, and I'm excluding families and elderly and disabled, but the general population, we're not talking about any accountability at all. And I think if we're going to change the paradigm here and do anything different, and I'm not hearing anything other than just expansion of service, we are not asking people to do anything different. And I would challenge the group to tell you that the data would support there's a large group of the general population that wants an accountable lifestyle. And I can give you those figures because you all have heard me mention serving on the Board of Stable Recovery. We have 200 people on the waiting list right now to get into stable recovery, and it is a militaristic accountability program. So people are not afraid of that type of opportunity. And I think somewhere in this process, we will have failed the community and we will have failed a lot of people if we don't develop a system for accountability for making people important parts of the community and the workforce. So I would challenge us as community servants, and I can assure you, you want the support of the business community. You're not going to get that unless you incorporate high levels of accountability into this population. And I suggest that we have to give serious consideration to that at some point in time. The last piece of information I want to ask, does anyone here know, and Commander Burnett may be the best to answer this, I don't know, but what would be the number of people that are homeless in Lexington that came to Lexington to be hospitalized either at UK or one of the other hospitals or Eastern State Hospital that have been turned loose and are on the streets in Lexington? Does anybody have a clue what that is?
I can probably help you with that. It's high.
So my comment on that is the following. I've had a couple of conversations with state legislators about, and I'm not a pro-government guy, but I think this is where our state needs to become involved in this. And I would encourage our community. I think a lot of people in Louisville and Northern Kentucky would feel the same way. We need state legislation that requires a community that brings a resident to Lexington, Louisville, Northern Kentucky for services to reclaim that person. Yes, you may. So I would challenge us to think about that. It's going to have to be part of a medical broader bill, but it's a dumping ground. We can't do that.
So as the person who administers the assistant outpatient treatment court, we have a lot of people that come here because we're a regional hospital here. Eastern State is here. So people from other jurisdictions come into Eastern State, and when they are released, discharged, they don't necessarily have a plan. Now, and I've addressed this with Eastern State and with UK, and of course they will argue and say that we don't just turn them out, but they don't come back and get them either. And the problem is that we don't have resources for the people who live in our community, less on someone, and they're usually young. It is a problem. It is a problem. But I don't know how to address that because the hospital is not going to take responsibility for making sure that they have some place to go before they discharge them.
And the community they came from doesn't want responsibility either.
Well, because they feel like we're the big city.
Right. But you will handle it.
They have enough, they have more resources than we do. So let them handle it. And they don't understand the strain on our resources as a result of that.
May I respond, Judge? We have an active, I don't know, Sally or Chris, I don't know if either of you are on we have an active group of UK, Eastern State, Empath Center, my chief of staff, others working on this exact problem because the numbers are sky high. They get released and they are here. But there is a group working on this right now. Charlie, are you on that?
Yes, in fact, that
Okay.
group is who we brought in for the public safety feedback session that
Okay.
we did. It was with
Okay.
that group.
Yeah. So they're currently working.
Thank you. Thank you. Zach.
Yep. Thank you, Madam Chair. I'll make an attempt at brevity. I know we have some public comment
We
as
do. I
well.
want to
So,
make sure. Yeah.
okay, great. Let's see if I can figure that out. Well, this will be fairly brief. I want to start with a caveat that while we have had several subcommittee meetings, the last meeting we had, a few of our members were not able to come, and then I distilled these recommendations into writing without the input of my fellow subcommittee members. So if they disagree with these recommendations, they should feel free to speak up and say so, and we'll formalize those before a future meeting with more input. Just to and to back up, we did make these recommendations based on what we just went through, the draft report of the Peer Cities and Shelter Models Committee and the Supportive Services and Prevention Committee. Just a quick summary. I think the basis of these recommendations are around primarily a single project, which is what we got out of those initial recommendations from that joint subcommittee report. And we do assume, and we'll get to that, that we would be using some LFUCG owned property for the kind of project that we feel has been described. The other thing is we have an assumption here, and a very large assumption in the numbers I'm going to put up, that this is all at the end of the day and a point in time when a project is built, because we'll talk about some reductions in annual spending that we would estimate. I understand fully that there's a phasing element to this and things don't happen all at once, and we can't assume that we have savings all at once. None of that is considered in these recommendations, and I understand and agree that it absolutely has to be. And so I think that's going to take some more time and some more input from other departments, and I'm happy to work with our committee to have some of those discussions. What Commissioner Ford has brought up is not in our recommendations, the idea of moving certain city services, and so there's a tremendous amount of work to be done to make these formal recommendations, and there's a tremendous amount of due diligence in some of the financing tools we're talking about that would have to be done by the law department and outside counsel and other various things. So just to start with some of our baseline assumptions that we've been talking about for the last couple of weeks or a couple of months, I've kind of bifurcated this into two buckets. There's, to me, an annual spend that we're making right now on the winter shelter that seems to be inefficient. And then there's the idea of capital for a new project. And I think at the end of the day, when a new project is built, there are some savings we would receive that could go towards other uses than the winter warming shelter. So to start with what I'm calling flexible annual expenditures, two kind of pots of money seem to stick out to us. One, the 2.4 some odd million that is being spent on the existing emergency disaster shelter. And then a little bit of discussion I want to have around the Innovative and Sustainable Solutions Fund. So those two pots of money and annual expenditures together are just north of 3.9 million. I'm just making some, honestly, shots in the dark at the end of the day, after a facility is built and in operation, what we would need to keep back from those existing pots of funding. First, I think we'd need at least 20% of the current annual spend for emergency disaster sheltering, yes. There was a report we were given that named it the emergency disaster.
Sorry, EDS is the name of the company, so it's a little confusing. Yeah.
Gotcha. Okay, well, I can use warming shelter, and so I think we would need 20% of that expenditure ongoing to continue to shelter people in emergencies. We can't assume that in extreme weather we're going to have no need for that spend. And then in discussions I had with Commissioner Lanter, I think there's about half of that Innovative and Sustainable Solutions Fund is really tied up in existing projects that if you were to pull it away would have some projects not be able to move forward. So we're saying some of that has to stay back. So that puts our remaining annual funds at about 2.7 million. So then to come over to capital, we use the baseline of the cost of a project like we're discussing, whether it be on Versailles Road or a similar property. We use the numbers in the EHI report that we were given at the beginning of this task force of about $27 million, but that did include the acquisition of new property. So we've estimated that about $2 million in benefit would come from not having to acquire property if we were to utilize city-owned facilities. Now, that brings us to a total capital raise of essentially $25 million. I will continue to give the caveat that there's a lot of due diligence and feasibility that needs to go into whether that's even a real number. But we had a baseline to use from the EHI report, and that was as good a place to start as any for this recommendation. So then to identify the baseline funding we understand could be available for such a capital project. First, the $2.8 million set aside by council, and I think I have that number right, for a project like this, and then also a set aside of the existing opioid settlement funding of about 2.2 million that I understand has been discussed to be set aside for some sort of homelessness prevention project. I also understand that utilizing that funding drastically changes the dynamic of what happens on a particular site.
It has to show a direct relation to opioid addiction abatement, direct.
Yep.
Yeah, according to the federal and state law.
And what I understand from the recommendations of the other subcommittees is that the particular project we're discussing would be multifaceted, would serve multiple populations on a single campus. And I think there would be ways, again, there's significant diligence and input from counsel that needs to come into this, legal counsel that would need to come into this. But I think you could bifurcate the housing types to utilize that funding in a bucket to where the entire property did not have to be set aside for opioid treatment, but a portion of it could be. Because I think within this same project, there's also this idea of a triage center that came out of the other subcommittee's report. So those two pots of money together, about $5 million, leaving a gap of $20 million. So getting to some recommendations, I'm actually going to start this time with financing options for that gap. Here's that Innovative and Sustainable Solutions Fund. Again, I think it would be this would be an innovative project. And I think to use a portion, I've got half of that annual allocation here for capital for something like this would be a worthwhile recommendation. Then another financing tool that came up in our discussions is a Section 108 guaranteed loan. And I've done a little bit of research on this, and Charlie has helped me quite a bit with this program. What this is recipients, jurisdictions that receive community development block grant funding from HUD are eligible to apply for a loan guarantee of up to 5 times their annual CDBG allocation. Of course, there's significant, it is with a HUD guarantee, there is reduced borrowing costs, but it's not insignificant, the borrowing cost. It's not free money, and it's not a grant, and it is a repayable loan. So if we commit to those two sources of funding, that leaves us a remaining gap of a little over $9 million. And I think there's 3 different options that we'll continue to discuss to fill that additional gap if the other options were taken up. I've separated them here as 3 distinct options, although I do not think they are distinct. I think they could be combined and used in various combinations. But there has been some discussion of additional bonding, which also comes with debt service costs. I think you could solicit some sort of affordable housing development, whether it be low-income housing tax credits or other type of funds, to take on a portion of this site. And I think that's where my particular expertise is. To raise $8 to $10 million for a particular project of 40 to 50 units is realistic within that world. Now, what's not listed here is anyone doing that would solicit funding from other departments within the city to support that, which is not here. And I think there's opportunity that's been discussed for legislative support, although we're going into a short session where they are unlikely to open the budget. There is, I believe, legislative support for the VOA campus in Louisville. The state legislature has been making one-time expenditures for particular projects across the state in the last several years. I certainly think that is somewhat wishful, but is worth advocating for maybe as a potential solution. And again, that's why I say I don't think any of these 3 options of gap financing live independently completely on their own. So to take back to our uses of annual funds after we take into account utilizing $750,000 of that Sustainable Solutions grant for capital, and then just what felt like low-hanging fruit in the recommendations. I believe it was recommendation number 9, an increase in the Emergency Financial Assistance Program funding. I've included $100,000 of an increase to that based on the recommendations of the other subcommittees. Kind of leaves us with remaining annual funds from the winter warming shelter of a little over $1.8 million. And what you see at the bottom is essentially what would be left based on the debt service costs if you went into the Section 108 loan. And if you also went in from that to an additional bonding cost. I've got some estimated debt service costs that Charlie and some folks in Sally's office and others helped us come up with estimated borrowing costs. They are what they are. Interest rates are a difficult thing to pin. And, I think there's structure questions and quite a bit of, again, due diligence that would need to go into to see if those borrowing costs are even realistic. But what that, I think the punchline that we kind of came to is there's some ways, some options we can explore to raise the capital for a specific capital project. Of course, none of that addresses ongoing operation of a facility. I don't think that it's realistic to say that the city with our current funding could operate a facility like that. I think we could help develop a capital structure to build a facility like that. And I think what our last discussion our subcommittee had was, if we can raise the capital to do that, what's left of the money that's been set aside for the winter warming shelter, some of that money can go to annual support of that facility. And the numbers that you'll see on the handout and that have been on the screen is anywhere between, $500,000 and $1 million of annual support for that facility. But I think you'd have to put out an RFP for a private or nonprofit. And when I say private, I'm lumping for-profit, nonprofit groups together there, kind of a private operator of that facility who can bring other sources of funding in for the day-to-day operations. And if you relieve the need for a massive capital raise from some of these organizations, I do think there are organizations that exist that could come up with the annual funding through various federal programs. They may use some support from us locally on an annual basis, but then through private donations and other programs they may operate. So that kind of distills down what I think summed up our various discussions over the last few months. The last recommendation we have here, I've mentioned this already, is we are going to bring some policy recommendations for the Affordable Housing Trust Fund, but we're waiting on some feedback from Mr. McQuady's office to do that. That's a lot of numbers. I was trying to be as brief as possible, happy to get into specifics and happy to do that, outside of this meeting and come back with more firmed up
Zach,
recommendations later.
I really appreciate it. And I'm sad we're not really going to be able to open up too much, but we'll figure out a time to do it. But I think what the takeaway is, we've been meeting together for a really long time, and there's been this smattering of information for services and peer models and finance. Finance really needed something to kind of go with. And so why we did the joint committees to come together. So I think the takeaway is we now have draft over all of this, but it's something we can begin to sink our teeth into a little bit to kind of go, yes, I love this. I love this area. I love this area. I don't know. We need to build accountability into this. Where is this in this section? So thank you so much for doing that. I do want to open up the floor. If we have anybody who is here for public comment, I'm so sorry. As you all know, we have two. Okay. So Curtis, Sharf, if you would come up, if it's okay. Should we be at the podium? You got the podium? Okay. We have like 2 minutes. I'm so sorry, but come on up. I can bring them up to him.
Will that work, or do you want me to come up front?
Wherever's comfortable.
You can stand there, or you can come to the podium.
Thank you. Thank you very much. I have my partner in business with me, Steve Verdon. But anyway, we still stand as we had proposed before, as I mentioned to you in the last meeting that we had. And we are concerned about the safety of all people down there. We do care very much. But then also, we are also hurting also because the lack of business, just like with the laundromat. They were down 42% in business. They can't keep their doors open. They had problems such as people sleeping on the floors and just everything going on in there. And as I had mentioned before, I won't take time to go through all these things here, but it still existed, and we cannot thank Commander Burnett enough for the assistance they gave us. The time that they gave after the meeting, I believe they made 9 arrests in one day, just from jaywalking to fights, just everything that goes on. But as we projected and mentioned that we would love to see a relocation And we felt, we still feel that old Frankfurt Pike would be there next to the police station. They already have a facility there with electric and so on, as well as a pad where they could put up the temporary housing and so on. And it would just be better for us because, like I said, there are probably two of our people that are receiving rent from right now. We haven't received since the first of the year because their business is lacking so much, and they are in fear they're going to have to close the doors because, especially just like the restaurant that's there, as soon as people would get out of the cars, these people were always hounding them, and they said, "Well, we're scared to get out of the cars now." So therefore, business has dropped off so much, just like in Purple Haze. They can't hardly get business done there. It's just gone down, and as well as the people that own the properties next to us, all their facilities have really dropped in business. And so we're just asking if you can relocate because we are very concerned, and to show that we are concerned, we actually serve and help serve meals. In fact, coming up soon, be going to one of the lighthouse ministries to serve meals. But so we are concerned, but we just ask people to reevaluate and look at the people that's involved, the neighborhood around, as well as the other businesses. Like I said before, a couple of businesses said if we don't quit getting pilferage, we can't keep our doors open. So it has really affected us. Okay, thank you for your time. Yes, we own from 1306 to 1256, which incorporates Purple Haze, Double H Barbecue, as well as O'Reilly's. And O'Reilly's, they have a majority of the business, and they're using the facility besides having retail. They have about 25,000 feet in a hub that they supply all their other stores around the area. I believe it's around 70 stores that they're supplying. Yes, it's a distribution center. Yes. 1950.
Thank you.
But
Thank you.
we thank you. Are there any other questions anyone would like to have?
I do want folks to know Tiffany passes around. So this was other sites that the city owned. So even though we have been looking at the for sale site, there are other sites that we're looking at. So as we're looking at recommendations, we need to consider to pay attention to that. Was there anybody else that had public comment? All right. Thank you so much. Well, you all, that is it for the task force. Our next meeting is June 10th. It is here at this site at 3:30. And I believe Chuck has a webinar that he wants everyone to attend. That's on May 21st. May 21st. Councilman, yeah, May 21st. Okay. All right. Yes. Yes. Thank you all so much for your work. I appreciate that we missed the last month, but I think it was well worth the energy. And now we have more work to do. Mayor?
I have, you all are doing wonderful work and I so appreciate it. I just want to say, as you move through your draft recommendations, this may sound counterintuitive, but the less detail you put in there, the more chance the government will be able to implement and have some flexibility. And so it sounds a little funny, but if you have your basic ideas, like many of these are very good kind of ideals, that's really helpful because I think we'll get locked into a box with a lot of detail. I might be the only one that thinks that, but we've seen it before. So thanks for all your good work.
Thank you all so much.